Hi, Dr. Saxena here, and well, let me share with you one of the interesting things what we did last week about how we try to solve the patient's problems. This basic, if I can give you this example, you can always understand what exactly this environmental medicine is going to help you in a big way. And it's not just trying to correct the only the symptoms and all. I can always talk about this was one of the things which we always gone. We were talking about something about indoor air pollution. We are talking about something like how we patient is at risk, and what are the steps you should take when you try to understand what is it, why your headache, what is this symptoms, which appear quite easy, but at the same time these things are really it becomes a very nasty. I'm just talking about something like headaches, constant headaches, eye, nose and throat irritation, eye irritation, excessive watering to the eyes, something like dry cough or itchy skin, something like dizziness and nausea, and something like difficulty in concentrating and irritability. So my foray is trying to look into what are these symptoms like. Somebody came to me with a constant headache, and it was we went on to check his RT-PCR and all that. Everything is negative, and his eyes were always burning. He has got something like post-nasal discharge. That means he has got the trickling sensation in the throat, which that is the irritation which is causing dry cough, and he's restless, and he feels that he has got some COVID or something. And this is one thing which I always I'm trying to work it out. He has got some something like spaciness. He is not concentrating properly. So based on this, I believe I started working on him, try to rule out each and everything. Lungs CT scan was clear. Paranasal sinuses ENT checkup was quite normal, and I believe this is something associated with something like a sick building syndrome. Yeah, I just want to talk about this thing called sick building syndrome, and wherein we have usually we try to look into this particular stuff as a environmentally challenged this one, and these are the symptoms which you get with the sick building syndrome. What is sick building syndrome? I can always go on and on. If you have something like molds in your home, and if you have got something like old building, dilapidated building, you have got something like water always trickles from some or the other corner and all. If your wooden furniture has got some molds in that, so you're probably into an atmosphere called sick building thing. And you are this is, I think I had worked out quite extensively about this, and we feel there's an outgassing of a lot of more volatile organic acids. So most of these problems are because of this the environment where you are living. So we asked our subject to change something, try to see that he opens his windows for some time, tries to see that he has that water kind of percolation and all that stops, or he can always look at some other areas, like trying to put some indoor plants, trying to work it out, because this mold is a big issue. And we always have in our environmental medicine, and we give a lot of emphasis on that. Your headache, your kind of symptoms what you are having now, this is something like simple things. It appears throat irritation always, you get into dry cough and all that, nausea and dizziness. Sometimes people they get into some kind of low blood pressure also. Because of that, they'll have difficulty in concentrating and constant irritability. So my foray is try to look at something which is environment before we label them as illness, which can be psychosomatic or ADD or ADHD. So this is what is this sick building syndrome all about. I just wanted to give a brief, and I don't want to get everything of sick building syndrome. You need to look at from your health perspective. If you are not getting not getting answers from the mainstream because of this kind of symptoms. Thank you.